Hi, my name is Maria Alstad. I'm a student at Boise State University. I'm about to graduate with my bachelor's degree in respiratory therapy. I am doing a study on narcolepsy, so I'm posting this YouTube video to help you better understand this disorder. So narcolepsy is a chronic neurological disorder which affects part of the brain that regulates when you're asleep and when you're awake. So how common is this disorder? Well, in the United States, 1 in 1,000 people actually have narcolepsy. So it's a pretty common disorder. Narcolepsy is the second leading cause of excessive daytime sleepiness after obstructive sleep apnea. So this disorder is equally common in men, women, children, and adults. However, narcolepsy typically appears in the early stages of adolescence. What's interesting is when you compare United States to other countries to see how common narcolepsy is in other countries. Well, in Japan, 1 in 600 people have narcolepsy. United States, 1 in 1,000, and Israel, 1 in 500,000. So there's definitely a genetic component. The cause of narcolepsy is not known. However, scientists have made progress toward identifying genes that strongly associate with this disorder. So these genes control the production of chemicals in the brain that may signal sleep and the wake cycle. And some experts actually think that narcolepsy may be due to a deficiency in the production of a chemical called hypocretin and also called orexin. And so in addition, researchers have discovered that abnormalities in various parts of the brain involved in regulating REM sleep. And according to experts, it's most likely that narcolepsy involves multiple factors than just one that interact to actually cause this neurological dysfunction and REM sleep abnormalities. So what are the signs and symptoms that are commonly involved with this disorder? Well, the most common ones are excessive daytime sleepiness and abnormal REM sleep. Excessive daytime sleepiness and cataplexy are often triggered by extreme emotions like laughter, sadness, surprise, or frustration. And cataplexy, what it is it's a loss of muscle control and body weakness. And it would actually affect the person depending how severe it is. So it may affect just the head, it may affect the whole body. Some other unusual symptoms of narcolepsy may be related to the abnormal REM sleep, including hallucinations, sleep paralysis, and cataplexy. So some people with narcolepsy experience vivid, sometimes frightening, visual or auditory sensations like while they're falling asleep or upon wakening, and those are called hallucinations. You may be unable to move or talk at the beginning or end of sleep, and that's called sleep paralysis. Also, narcoleptic patients may suffer with microsleep, which are very brief sleep episodes during which you continue to function, talk, read, listen, and then you awaken with no memory of what just happened. What were you doing? Narcoleptic patients have unique sleep cycles. They enter the REM sleep right after falling asleep, whereas most people, it takes about 90 minutes to actually enter the REM sleep. So therefore, they experience that characteristic of REM sleep, like vivid dreams and muscle paralysis at the beginning of sleep, even if that sleep is during the day. So how is narcolepsy diagnosed? Well, diagnosis for narcolepsy is usually easy if all the symptoms of illness are present. However, the problem is that usually the symptoms like cataplexy are usually really mild. So 2 tests are usually considered essential in confirming the diagnosis of narcolepsy, and those are the polysomnogram, PSG, and the multiple sleep latency test, MSLT. So the PSG is an overnight test that can be done and to eliminate the possibility that the individual symptoms result from like another possible condition. The MSLT is performed during the day to measure a person's tendency to fall asleep and to examine REM sleep. As part of the test, an individual is asked to take 4 or 5 short naps that are scheduled 2 hours apart. And so how is narcolepsy treated? Well, Although there's no cure exists for narcolepsy, a combination of treatments can help to control narcolepsy symptoms and help patients to enjoy their normal life. So the treatment is usually specific based upon patient's symptoms, but will likely include a combination of counseling, medication, and lifestyle changes. So it's very common for those with narcolepsy to suffer from depression. So reaching out to a psychologist, counselor, or a narcolepsy support group can help to cope with the effects of this disorder. And sleepiness is treated with amphetamine, while the symptoms of abnormal REM sleep are treated with using antidepressant drugs. Lifestyle changes are like avoiding caffeine, alcohol, nicotine, and heavy meals. Could be very beneficial. Also, better regulating sleep, like scheduling taking naps during the day, 10 to 15 minutes in length. Establishing a normal exercise and meal schedule may also help to reduce the narcolepsy symptoms. So this is basically my video. Thank you so much for watching this YouTube video, and hopefully it was useful and beneficial to you. Thank you.